Hello, everyone, and a very warm welcome, a very good evening to all of you. And I am back with another beautiful, mind opening, eye opening, enlightening episode of Improve Your RCs. Um, you started with a question, so I'll start with an answer. Prashant, accuracy is not a topic कि पैराजंबल कैसे improve होगा, okay, या inferences कैसे improve होंगे. Accuracy is a skill, and when you are working on a skill, it's a time taking activity. Plus, right now you are talking about VARC, which is a language based session, right? So you got to be patient and reduce your number of attempts if you want, but as many attempts as you are doing, try and get them right. So the first thing that you should be working on is मैं जितने करूँगा सही करूँगा. Whatever number of questions you're solving, try and get them right. When you start getting most of the questions right, then you can increase your number of attempts. Once you start doing that, you can also keep an eye on the timer and work on your speed. So that's the ladder. That's how you go about it. Good evening. Namaste, everyone. I hope all of you are doing fine. Those of you are here for the first time, my name is Karishma, and I bring to you this series known as Improve Your RC, where we pick up fascinating articles from various eclectic sources, and we try to do a couple of questions based on them. Sometimes the article is so interesting that we are not left with any time for questions. But yeah, today I'll try to manage both. So we'll do a couple of questions and we'll do an article. Before we begin, I have a question for you. If somebody has a mental disorder, for example, let's say PTSD, post-traumatic stress disorder, or somebody has OCD, obsessive compulsive disorder, or somebody is fighting clinical depression, or somebody is fighting anxiety, yeah, very, very common these days. Is this about the brain not working properly? Or is this independent of how your brain works? What do you think is true according to you? Please type your answers. I want to know तुम लोग कितना knowledge रखते हो. Autism is not just limited to your mental nuances not being in place. It's very different from the names that I gave you. Yes, Neeraj. I know that they are disorders. What I'm saying is that is it because there's something wrong with your brain, or is it independent of your brain? Is it a biological issue, or is it just a mind issue? That's what I'm asking you. Related to the brain, independent. Brain not being able to perform properly. Both. Independent. All right. So this is exactly what we are going to discuss today. So is it about our brain, or is it independent of how the brain works, because brain is a biological organ? We discussed this in the RC genre psychology class that brain, bheja, मस्तिष्क जिसे हम कहते हैं, is actually a biological entity. You have seen the shapes and the MRI scans and probably a brain of an animal or something, yeah, in a poultry shop. So you know how a brain looks. But if I ask you, what about your mind? So you just get up in the morning and you're like, I don't feel like living. I don't feel like breathing. Is this the brain issue, or is this a mind issue? Man nahi kar raha hai, we say. So man can be seen or it cannot be seen. So when your man nahi kar raha hai happens, is it because there is some unknown entity inside you, or is it your brain showing you tantrums? Let's dive deeper into this topic and see how the two are interconnected, if at all they are connected. This is a quick look at what I'm doing as free classes this month. These are absolutely free. You just log into them by using my code Karishma Live. And this Saturday, I'm going to do a good solid OMETS practice. OMETS is other management entrance tests, which means non-CAT exams. Check out the remaining classes on my profile on Unacademy. On Friday, I'm doing a simple but special session on how you can keep yourself focused now that a lot of you feel burnt out, exhausted, unable to concentrate, distracted, blah, blah, blah. So we'll discuss all of this and more and answer your queries regarding this on Friday at 5 p.m. Take the skill builder test happening on Unacademy and check out my plus courses. Today I have a decision making class with you at 7:30. I'll see you there very soon. Almost everyone reading this article will know someone with a mental health disorder, even if they are lucky enough not to have experienced one themselves. Unfortunately, although many treatments are available today, they continue to involve a great deal of guesswork. So there are so many treatments these days about mental disorders, yeah, but it's largely, a lot of it is about guesswork. For instance, if someone is feeling down and sad every day, or has lost all interest in the things they usually like, they don't feel like doing anything, like pretty much anything, This could be a sign of depression, a major sign of depression. Their GP, which is a general practitioner, yeah, the one you go to whenever you're not feeling well. Yeah, usually before a psychiatrist, people might want to approach a GP, a general practitioner. Will usually either offer them an antidepressant drug or put them on a waiting list for psychological therapy. तो जीपी को अगर लगता है कि ये मेरे बस का नहीं है केस, तो वो आपको या तो एंटी डिप्रेसेंट्स पे डाल देता है या फिर वो आपको थेरेपी के लिए लिस्ट में डलवा देता है या आपको थेरेपी सजेस्ट करता है. These treatments are somewhat effective. Each treats depression successfully in about half the cases. So what is the success rate? 50%. Each of them, चाहे आप थेरेपी की बात करें चाहे आप एंटी डिप्रेसेंट्स की बात करें. The problem is there is currently no way to tell whether someone would be more likely to get better after therapy or after drugs or a combination of the two. Instead, clinicians use trial and error. So let's say I am fighting a problem and I go to a physician or maybe a psychiatrist. The psychiatrist might also be confused that this person needs antidepressants, some somnific drugs, or maybe therapy will become a better prognosis and prognosis in this particular case. तो ये पता लगाने का कोई सॉलिड तरीका नहीं है कि this patient should be given therapy and this patient should be given antidepressants and this patient should be given somnific drugs and this patient should be given a combination of all the two or all the three. So then what are people doing? What are the doctors doing? They are doing trial and error. To better predict who needs which treatment, we need to understand how and why mental health treatments work. Moreover, we need to find out why for too many people they don't work at all. So somebody might come to you and I've heard such cases, but I'm sure you must have heard them too, कि I'm fighting clinical depression for the last 2 years and I've been taking medicines but nothing is working. On the other hand, you may find people who will tell you that I've been fighting anxiety and depression for the last 3 years and I have been talking to my therapist a great deal, yet I'm not recovering. And then there will be people who will tell you that I took just 4 out of 5 sessions with my therapist and I'm great. So it worked for me. So there are all sorts of people. So for some people, something is working. For some people, nothing is working. For some people, everything is working. So we do not have a proper data in a very quantified, in a very rational way where we can decide कि इस व्यक्ति के साथ ये करना चाहिए. This is what is suitable for you and this is what is not suitable for you. I come at this dilemma as a neuroscientist. An essential but unanswered question in my field is, can the brain changes evoked by treatments, whether drug-based or psychotherapy, explain why some people get better after each specific form of treatment? कहता है कि मैं ये जानना चाहती हूँ कि ड्रग बेस्ड ट्रीटमेंट चलाएं या थेरेपी लें, और ऐसा क्यों है कि कुछ लोगों के साथ कुछ चीज़ें अच्छे से काम करती है या ज़्यादा अच्छे से काम करती है. सो सम पीपल गेट बेटर आफ्टर अ स्पेसिफिक काइंड ऑफ अ ट्रीटमेंट. Perhaps you are surprised, or in fact you are even skeptical, you are doubtful that neuroscience can have anything to say about the effectiveness of therapy. So a lot of people will say, why is a neuroscientist discussing psychotherapy? Doesn't make any sense to me. And the answer to this is that both medication and therapy are biological interventions. अभी बहुत लोगों को ये बात पचती नहीं, क्यों कहते हैं अच्छा थेरेपी कहाँ बायोलॉजिकली इंटरवीन करिए, मेरा थेरेपिस्ट मुझसे बात करता है, ये कहाँ बायोलॉजिकल इंटरवेंशन. आजकल जूम पे थेरेपी होती है. Many studies show that they change the biology of the brain. So the work that is happening, that a good therapist does, is not just, India में there is this fashion that people say therapist बातें सुनने का या बातें करने का पैसा लेता है. That's a very ridiculous way of talking about such a beautiful profession, because they're helping so many people and they are changing your biology if they're doing their job right, and if you are doing what they're asking you to do. Simple assignments can change the biology of your brain. This should not be a controversial statement, but it is. तो इसमें कोई कंट्रोवर्सी नहीं होनी चाहिए कि ड्रग्स अगर बायोलॉजी पे काम करते हैं तो थेरेपी भी बायोलॉजी पे काम करती है. तो कोई कंट्रोवर्सी है नहीं, ऑथर कहती है, लेकिन कंट्रोवर्सी है, लोग नहीं मानते हैं. विद इन साइकोलॉजी देयर इज अ रेजिंग डिबेट over whether or not mental health disorders are also brain disorders. So as long as I'm saying that I have anxiety and it's about my mind not being in the right place, it's okay. But if somebody tells me that something is wrong with my brain, I might not take it very well, because I would like to tell them that there's perfectly, my body and my brain is perfectly fine and there is nothing biologically incorrect with me. We'll go ahead. The Panchu books ka, there is a session. You go to my playlist, you go to my sessions, you will see books to read for CAT. There is a session already on YouTube. The default answer on many medical websites is yes. ऑल्दो दिस इज ऑफन एस्क्राइब टू अ सिंपलिस्टिक व्यू. तो क्वेश्चन क्या था कि क्या मेंटल डिसऑर्डर्स ब्रेन डिसऑर्डर्स भी हैं? तो डिफ़ॉल्ट आंसर काफ़ी वेबसाइट्स पे येस हाँ है, लेकिन ये बहुत सिंपलिस्टिक है. ये यू आर सिंप्लीफाइंग इट वे टू मच. Mental health disorders are caused by chemical deficits in the brain. So somebody is feeling sad and you tell them, oh, nothing, your dopamine levels are low. Oh, nothing, your serotonin is not working properly, take a dose. That's a ridiculous way of talking about feeling low, isn't it? That's a very biological way of looking at something that you feel as an emotion. This explanation is far too simplistic. आपने ज़रूरत से ज़्यादा उसे simplify कर दिया है. It depends on the region of the brain, the specific group of patients and many other factors. बहुत सारी चीज़ें हैं जो यहाँ काम कर रही हैं. ब्रेन का कौन सा रीजन अफेक्टेड है, किस पेशेंट से बात हो रही है, क्या फैक्टर्स इन्वॉल्व हैं उसकी सिचुएशन में, एवरीथिंग. ऑन द अदर हैंड, देयर इज अ ग्रोइंग कोरस ऑफ साइकोलॉजिस्ट्स एंड फिलोसोफर्स who will tell you that mental health disorders are definitely not brain disorders. For instance, a report published by the British Psychological Society's Division of Clinical Psychology in 2016 claimed that there is no evidence that mental distress is primarily caused by biochemical imbalances, genes, or something wrong with the brain. Rather, the author suggested that mental distress is outside the body. These people, this wing, this part of the debaters will say that it is always external. It's because of your environment, your parenting, a wrong relationship, your betrayal by the society, your upbringing, blah, blah, blah. Completely external, environmental, childhood experiences, abuse, poverty. This goes hand in hand with assertions that treatment should also come from outside the body. So you do not need a pill, you need somebody to talk to, and you need to change your behavior and your habits, and journaling and things like that can help you. Plus, there has to be a change in the politics and the society around you. This is completely external, whereas when you talk about biology, maybe popping pills is a good idea because then it's an internal thing. And for biological diseases, what do? We do pop pills or syringes or vaccines or whatever. I agree that there is no doubt that external factors are extremely important risks for mental health disorders, and I do not doubt the utility of psychological और social interventions. तो कहता है कि भाई इस बात में कोई दो राय नहीं है कि एक्सटर्नल फैक्टर्स बड़े इंपॉर्टेंट हैं, और मैं बिल्कुल भी डाउट नहीं करती हूँ कि साइकोलॉजिकल और सोशल इंटरवेंशंस की अपनी यूटिलिटी नहीं है. दे आर वेरी वेरी इंपॉर्टेंट. I suspect the heart of the disagreement originates from people's vastly different ideas of what it means to say that something is a brain disorder. Then the disagreement is happening. Why? Because many people cannot understand what is a brain disorder. थिंक अबाउट अनदर ऑर्गन सिस्टम. हार्ट का एग्जाम्पल लीजिए. कार्डियोवैस्कुलर डिस्फंक्शन है किसी को आफ्टर अ लाइफ टाइम ऑफ एनवायरमेंटल रिस्क फैक्टर्स. व्हाट आर एनवायरमेंटल रिस्क फैक्टर्स? हाउ एंड व्हाट डू यू ईट? हाउ मच अमाउंट ऑफ स्ट्रेस यू हैव इन योर लाइफ? आर यू अ स्मोकर और नॉट? आर यू अ person who drinks or not? Are you a teetotaler, etc.? Does that mean the condition is not really a heart disease? In such a case, should research and treatment for cardiovascular dysfunction primarily focus on preventing diet and lifestyle interventions rather than on the biology of the heart? तो कोई दिल का मरीज़ है तो आप उसको ये बोलोगे कि बस सुट्टा छोड़ दो? नहीं ना. You will worry about सुट्टा, but you will also worry about how the heart is working. You will concentrate on the organ also. Few people would go so far. Instead, they probably agree that while external factors make an important contribution to the disease, nonetheless, the biology of the heart remains crucial to understanding and treating the disease. It's the same with BP. So many people in our country are blood pressure patients. And it is largely because of a wrong lifestyle, eating too much or too less salt, not exercising enough, having oily and cholesterol-rich diets. But there is also a stress element to it which is largely responsible for it. A lot of people die of stroke, and those strokes are majorly out of stress and not just your body functioning in the wrong way. So then, when there is a BP patient, I don't just ask them to reduce their stress as a doctor. I ask them that yes, they should work on stress management, but then I'm also giving them a goli to have subah khali pet every day. So this is what the author says, that you should have the same approach towards your brain. You should not have different approaches for different organs. I believe the same logic applies to mental health conditions, including those with important environmental risk factors such as PTSD, post-traumatic stress disorder, which by definition requires a preceding trauma. Abhi PTSD is usually found in people soldiers basically who went to war, or people who have been abused very badly. You cannot have PTSD just like that, बैठे. PTSD का मतलब ही है कि उसकी एक प्रीसीडिंग एक्सटर्नल कंडीशन थी, और वो क्या है? ट्रॉमा हो सकता है किसी भी तरीके का. हाउ डज ट्रॉमा कॉज पोस्ट ट्रॉमेटिक डिसऑर्डर? तो अभी फिर ये बात इनवैलिड है कि हम ब्रेन पे कॉन्सेंट्रेट करें, जबकि PTSD केम फ्रॉम आउटसाइड, लाइफ एक्सपीरियंसेस का खेल है, भेजे का तो कोई प्रॉब्लम नहीं है. तो ऑथर यहाँ कहती है, जस्ट एज स्मोकिंग, स्ट्रेस और डाइट अफेक्ट द बायोलॉजी ऑफ द हार्ट, trauma changes your biology of the nervous system. So don't think that experience of war, which was very external, happening on the external personality of the soldier, did not have an impact on the body. Your nervous system is greatly impacted in the same way like your cardiovascular system is impacted if you are smoking and not having proper diet and not exercising enough. In these the neural changes, आपका neural pattern बदल जाता है, आपके neurons ही change हो जाते हैं. Alter your thoughts, feelings and behaviors. How you feel is largely about how your nervous system works, and this is why they always say that when you are exercising, you might not feel good while you are going to the gym or while you are stepping down the stairs, but once you start exercising, you start feeling good because endorphins get released, and those endorphins make sure that you feel pumped up. So this is why the resistance is only primary. The neural changes that happen in your body are biological. So this is why, and because they're biological, you end up feeling happy. Now being happy and endorphin getting released, endorphins is biological, whereas feeling happy is an emotional state, but the two are connected. It's not that they are disconnected. If someone has particular brain characteristics that make them vulnerable, these could also originate from environmental or genetic sources. Let's say I also went to war, and maybe Lavanya was a fellow soldier, so she also went to war with me. But Lavanya was stronger as a person. I wasn't, because maybe I had a childhood full of bullying and shaming and stuff like that, and this is why I was more vulnerable. So my environmental factors or maybe my genes have made me more vulnerable. Then I have more chances of developing PTSD than Lavanya. Such neural changes can result in PTSD. So yes, there is environment at play, but the same situations, different people react differently. I should add that I do not think that mental health occurs only via the brain. Author कहती है कि मैं ये नहीं कहती हूँ कि सारा खेल brain का है. The rest of the body is also playing a crucial role. In the past 20 years, neuroscientists have made huge leaps in identifying brain changes in people suffering from mental health conditions. Each leap, each jump has been accompanied by a great hope that this finding would be a crucial variable for improving mental health treatment. हम लगातार research कर रहे हैं, हम हमेशा उम्मीद लगाते हैं कि कुछ अच्छा निकल कर सामने आएगा जो हमारी हेल्प करेगा. Occasionally this hope has been justified. For instance, in 2008 some patients with encephalitis who were experiencing, now read this example, it's really nice. कुछ patients को encephalitis था. They were experiencing delusion, hallucination and other symptoms. When these patients underwent some tests, they showed us that they had autoantibodies. And these autoantibodies, I hope you've read a little or heard a little about autoimmunodeficiency disorders, autoimmune disorders. If not, please take it as a small homework. Read about autoimmune disorders, how your body fights against you and it does not work in your favor. Okay, so that target particular receptors in the brain, most commonly the NMDA receptor. NMDA receptor is basically a protein neurotransmitter receptor in your body. So people have encephalitis. What are the symptoms? Illusion, delusion, hallucination and symptoms like that. What is the biological problem? Autoantibodies are being produced and NMDA receptor is being targeted because of these antibodies. Your body is targeting your own body, another part of your body. These patients are normally first seen by psychiatrist. भाई मुझे अगर hallucination हो रहे हैं तो obviously फिर मैं psychiatrist के पास जाऊँगी ना, physician के पास तो नहीं जाऊँगी. Given the similarity of the symptoms that they have to classical psychosis. So because hallucination is not considered a biological symptom but a mental symptom, such patients go to the doctor who is a psychiatrist. Patients with similar symptoms can be screened to search for particular antibodies in their blood or cerebrospinal fluid, and if the search is positive, treated using immunotherapy. लेकिन ये गए हैं साइकेट्रिस्ट के पास, लेकिन अगर हम इनको स्क्रीन करें, टेस्ट करें और देखें कि इनके पास अननेसेसरी ऑटो एंटीबॉडीज़ तो नहीं है इनके ब्लड में या सेरिब्रल स्पाइनल फ्लूइड में, द फ्लूइड बिटवीन योर ब्रेन एंड स्पाइन, और अगर ये निकलता है तो हम इनको इम्यूनोथेरेपी से ट्रीट कर सकते हैं. हमको उनको काउंसलिंग देने की ज़रूरत नहीं पड़ेगी. However, aside from such rare exceptions, understanding that how the brain's circuitry changes in mental health has not yet revolutionized our ability to treat mental health disorders. तो ये बड़ा फंटास्टिक है. मैंने सोचा मुझे X बीमारी है बट Y निकली, तो अगर डॉक्टर पकड़ लेता है कि Y बीमारी है, he can treat me for Y and then I get fine. I don't have to worry about X then. But we are not completely sure about such things happening, so research is still going on. Part of the reason is that we are only just beginning to learn how existing treatments such as antidepressant medication and cognitive therapy change the brain. अभी हम क्यों इतनी जानकारी नहीं है, because अभी भी research चल रही है और एंटी डिप्रेसेंट मेडिकेशन की बात करें या कॉग्निटिव थेरेपी की बात करें, हाउ दीज टू थिंग्स चेंज द ब्रेन इज स्टिल बीइंग वर्कड ऑन. वी आर स्टिल रिसर्चिंग अबाउट इट. A key question here is whether antidepressant medication and psychological therapy cause similar changes. तो क्या दोनों सिमिलर तरीके से ब्रेन को चेंज करती हैं या डिफरेंट तरीके से काम करती हैं? अगर सेम तरीके से चेंज करती हैं, अगर इफ दे कॉज सिमिलर चेंजेस, then it means that it might feel different to take a medication compared with attending therapy. The two treatments are working in similar ways on the same neural processes. I'm talking to a therapist in a Zoom session, okay, paying her by the hour. And I'm also taking anxiety or depression antidepressants, drugs, okay. If there is research that can prove that both of them are causing the same changes in my brain and both of them are working on the same neural processes, it's a new discovery in itself. Let's say they are not working in the same way. If they are doing different things to my brain, then this indicates that working via different neural mechanisms, again there is a potential effectiveness, because then you can do two things: work on different parts of my brain and increase the intensity. The sad part is, like written here, the research is still going on, it's not over, so we do not know this completely कि दोनों कैसे हमारे brain के साथ खेलते हैं. To find some answers, my colleagues and I gathered data from 24 previous antidepressant trials and 19 previous cognitive therapy trials. Thanks to scientists around the world who sent me their data. This included brain scan data from hundreds of patients with different disorders, alag-alag, depression, anxiety, several others, by comparing changes in brain activation after a treatment compared with pre-treatment. So what is the author comparing here along with fellow researchers? They are comparing brain activation after a treatment with pre-treatment. We were able to visualize which bits of the brain changed as a result of the treatment and look if there were any overlapping areas. तो हमने भैया पकड़ लिए लोग. इसमें से 24 trials were about antidepressants. 19 were therapy, okay, and then we saw the brain activation pre-treatment and post-treatment. After that, we thought that we will see what are the overlapping areas. Are they working on the same thing or are they working on the different parts of the brain? The results were striking. There was no overlap between the brain changes from antidepressants and those from therapy. Therapy is working on some other part of the brain. Antidepressants are working on completely different part of the brain. What are they? Psychological therapy specifically changed brain activation in the prefrontal cortex. Therapy किस पे काम करती है? आपके medial prefrontal cortex पे काम करती है. ये किस चीज़ के साथ एसोसिएटेड है? ये आपके अटेंशन और अवेयरनेस, इमोशनल स्टेट के साथ एसोसिएटेड है. तो आप अगर देखोगे थेरेपी से हमें क्या फ़ायदा होता है? वी कैन इम्प्रूव आवर अटेंशन, वी कैन रेगुलेट आवर इमोशंस बेटर, वी बिकम अवेयर दैट वी आर reacting in ways that we shouldn't. This is what therapy is doing to you. You know, you can do this to yourself also. People who cannot afford therapy simply listen to people on YouTube and they read posts on Instagram and they that's therapy for them. Yeah. So then, whereas antidepressant medication, now that's working on your amygdala. You remember amygdala is also the part of your brain which is responsible for fear. I have taught you this in the RAT RC in the plus class. It's directly implicated in generating emotions. एमाइगडाला पर काम करते हैं, एमाइगडाला से इमोशंस जन्म लेते हैं. द काइंड ऑफ न्यूरोट्रांसमिटर्स एंड हॉर्मोन्स दैट आर रिक्वायर्ड टू प्रोड्यूस दोज इमोशंस राइज फ्रॉम देयर. सो एंटीडिप्रेसेंट्स आर वर्किंग ऑन योर एमाइगडाला. Therapy is working on your prefrontal cortex. Both of them are working on different parts of the brain. Although medication and therapy affected anatomically distinct regions, these regions are functionally related. अभी distinct है, लेकिन function से related है. In a separate analysis involving data from a large group of participants exposed to emotional stimuli in a brain scanner, we found that both regions significantly overlapped with the brain's so-called affect network. तो जब हमने ये देखा कि emotional stimuli अगर होता है और फिर इनका ब्रेन स्कैन किया गया, तो हमने देखा फिर ओवरलैपिंग एरिया निकलता है. व्हाट इज आवर ओवरलैपिंग एरिया? अफेक्ट नेटवर्क. दिस नेटवर्क इज मेड अप ऑफ इंटरकनेक्टेड रीजन्स. एंड व्हाट इज द इंटरकनेक्टेड रीजन? द वन दैट इज रिस्पॉन्सिबल फॉर मेकिंग यू फील emotions like angry, happy, sad and so on, and of course the other emotions that are arising in you. In other words, antidepressant medication and psychological therapy act on different parts of the same functional brain network. Same functional area पे react करते हैं लेकिन different parts पे. Based on what is known about the different components of the affect network, our work suggests that psychological therapy alters the functioning of brain regions involved in focusing your conscious attention or feelings. What does therapy does? Therapy alters, changes your brain regions by making you conscious, making you attentive towards feelings, and that gives you an aim in many types of therapy. Antidepressant क्या करते हैं? They concentrate on the region of the brain which is involved in experiencing. So maybe you do not feel as strong feeling like you were feeling before the drug. After the drug, maybe you feel less of the less of problems, less of anxiety. So potentially directly changing your emotional experience. इसमें हमें खुद पर थोड़ा ज़्यादा काम करना पड़ता है, इसमें ड्रग्स हम पर काम करते हैं. These findings have important implications, implying that the two treatment modalities could work additively. तो अगर दोनों अलग अलग काम कर रहे हैं, कुछ कदम आप चलो, कुछ कदम मैं चलूँ, तो फिर साथ चल सकते हैं. Another important implication of this line of work is in showing the potential value of discovering biomarkers. Biomarkers are brain signatures. हर एक का अलग होता है. That might predict which treatment is best for which patient. तो अगर हम ये सक्सेसफुल हो जाते हैं सारी रिसर्च में, तो हम ब्रेन सिग्नेचर चेक करके बता सकते हैं कि which treatment is best for whom. If antidepressant medication and therapy have distinct effects, then patients whose brains show specific local functional changes will more likely to be respond to the interventions that target the same regions. From our study, you might hypothesize that these people would respond better to therapy. So basically, after all of this research, we can tell you by looking at your biomarker that what will suit you more. Will therapy suit you more or will antidepressants work more for you? In contrast, those with changes elsewhere, कहीं और अगर change है जैसे amygdala में, तो फिर आप antidepressants पे बेहतर perform करेंगे. We need to test these, but yeah, there have been previous research studies supporting these. A brain-based approach to mental disorders might also help us invent new treatments. During my PhD, we visited XYZ in London, scanned patients' brains and gave them brain stimulation prior to their psychological therapy, and then scanned their brains again when they were complete. So this is again talking about a research where they scanned patients' brains, gave them therapy, okay, and then scanned their brains again. Now, while she was recruiting patients for the trial, everybody said that, oh, nothing works for us, we've tried everything, हमारे ऊपर कुछ भी काम नहीं करता है. Then we discovered a way to massively increase the number of patients who recovered after a course of CBT. CBT is cognitive behavioral therapy basically. We did not manage that, but we did make an exciting and important finding. So basically this is saying that जिन लोगों पर नहीं काम करता था, उन लोगों पर भी काम किया. क्योंकि जब इसने रिक्रूट करा और जब ये लोग बोल रहे थे कि हमारे ऊपर कोई ट्रीटमेंट काम नहीं करता, लेकिन इसने जब ट्रायल करा और लोगों को प्रॉपर थेरेपी दिलवाई गई, तो फिर ये एक्सेप्शन निकला बिकॉज देन पीपल रिकवर्ड, विच वॉज वेरी वेरी इंपॉर्टेंट एंड इट वॉज एक्साइटिंग. सम पेशेंट शोड अ सिग्निफिकेंट बेनिफिट ऑफ द कंबाइंड ट्रीटमेंट, थेरेपी प्लस एंटी-डिप्रेसेंट. सम डिड नॉट, जैसा कि हमेशा होता है. सो देर इज नो 100% ट्रीटमेंट. Crucially, the brain scans we conducted showed that it was the patients, now read this, with the highest pre-treatment activity in the prefrontal cortex to be disrupted in many patients with depression, who were the ones most likely to respond to treatment. किन लोगों ने सबसे ज़्यादा रिस्पॉन्ड करा? जिनकी प्रीफ्रंटल कॉर्टेक्स ब्रेन एक्टिविटी में दिखा दिया था कि यहाँ प्रॉब्लम है. हमने पढ़ लिया प्रीफ्रंटल कॉर्टेक्स पे सबसे ज़्यादा थेरेपी काम करती है, तो दे शोड बेस्ट रिजल्ट्स. दिस वॉज नॉट द केस फॉर अ प्लेसिबो ग्रुप, जो कंपैरिजन कंट्रोल ग्रुप होता है, उसको प्लेसिबो पे डाला गया, उनको भी थेरेपी दी गई थी. बट इन अदर वर्ड्स, इंक्रीज एक्टिवेशन इन द प्री फ्रंटल कॉर्टेक्स वॉज अ स्पेसिफिक प्रेडिक्टर. लेकिन क्योंकि इनके साथ प्री फ्रंटल कॉर्टेक्स का उतना इशू नहीं था, तो उतना अच्छा इफेक्टिव रिजल्ट नहीं आया. दिस वॉज सेवरल ईयर्स अगो, बट इट रिमेन्स माई फेवरेट रिजल्ट फ्रॉम ऑल रिसर्च. Despite a not particularly successful treatment overall, we uncovered useful information about who it worked for and why, and this takes us a step closer to identifying the right treatment for every patient. This brings us to the end of the article. The most vital dilemma or quandary of mental health disorders today is not whether they change the brain. ये सवाल ही नहीं है कि mental disorders से brain change होता है क्या. The question that I began my session with. सवाल ये है कि कैसे change होता है. A cleverer approach to treatment in future might measure कैसे a patient's brain changes. Maybe use a smartphone app, quantify your behavior, direct your patient to the treatment that will work best for you according to your brain and behavioral metrics, irrespective of your diagnosis. Symptoms कुछ भी हों, लेकिन अगर स्मार्टफोन ऐप्स बना देते हैं हम, या हम क्वान्टिफाई कर पाते हैं आपके बिहेवियर को और आपके ब्रेन चेंजेस को, हम आपको बता पाएंगे दैट एग्जैक्टली व्हाट ट्रीटमेंट इज गोइंग टू वर्क फॉर यू. Some studies have begun to test this, but we are a long way from a solution. A crucial scientific challenge of our era will be measuring the cognitive and biological changes occurring in mental health on an individual level and mapping out their relationships with treatment outcomes. It will not be easy, but it could be transformative for mental health. I am hopeful that a more personalized approach will come up, and then we could eventually improve the lives of people who are struggling with mental disorders by helping clinicians. ट्रायल एंड एरर करने वाले क्लिनिशियंस को हम साफ साफ बता पाएंगे कि क्या सही ट्रीटमेंट है, चाहे वो मेडिकेशन हो, चाहे थेरेपी हो, चाहे कम्प्लीटली कोई अलग बात हो. लेट्स डू अ कपल ऑफ क्वेश्चंस नाउ. This beautiful offer has come up on Unacademy. This is really nice for a 2022 or a 2023 aspirant, where you are getting 3 months free with a 12-month or a 24-month subscription. So all your exams, CAT and OMETs will get covered. You can use my code to grab a discount as well. These are the rates going on for 12 and 24 months. Please do check them out on the Unacademy website. Let's do the first question for the day. What kind of a question is this and what is your answer? Okay. Alright. How does neuroscience have anything to say about how efficacious therapy is? Is that a question whose answer is there in the passage? Yes. What is the answer? The author explains you that both of them, neuroscience as well as therapy, both of them work on your biology. Both of them have something to do with your brain. It's no more a question whether it exists, it's a question of how much it does or how it does. So yes, this is answered. Do therapy and drugs work better in isolation or together? Yes. Additively वाला passage. साथ में दें, अलग अलग दें, किसको क्या दें? This question gets answered. Prefrontal cortex versus amygdala. ऑटो एंटीबॉडीज इम्यूनोथेरेपी में कैसे कंट्रीब्यूट करती है, इसके बारे में कुछ लिखा हुआ नहीं है. इम्यूनोथेरेपी से हम ऑटो एंटीबॉडीज के साथ डील कर सकते हैं. दिस इज फैक्चुअली रॉन्ग. What potential do biomarkers have in diagnosis and prognosis? This is also explained. If we know your brain signature or your biomarker, we can tell you your diagnosis and prognosis. Good attempt. What about this one? Very easy. Those of you who've read this article already can skip this question. I want the other people to try. Also, let me know if you are interested on Wednesday, if you're interested in doing a previous year passage. Are you interested in doing a previous year passage for a change rather than an article? Or you want me to do an article? Let me know. What is your choice? Okay, any other answers? Suhas says B. No, Suhas says D. Vaishnavi D. Anshu D. Okay. Any other answers, please? Everybody saying D. Surat says C. Okay. Brain disorders are mental disorders. Is that true? Syllogisms. I have taught you reductive reasoning. Let's see. All brain disorders are mental disorders. True or false? किसी को ब्रेन डैमेज हो जाएगा तो वो मेंटल डिसऑर्डर में बदल जाएगा. नो, रॉन्ग. Mental disorders are brain disorders. Yes, the author keeps saying that mental disorders have something to do with the brain not working properly. Disorders and their roots in our brains. What disorders? Mental or physical? Brain, the Pandora's box of disorders. Are the disorders, all of them, happening in the brain? What about PTSD example? Also, what form of disorders? Physical or psychological? Also, when it comes to psychological, what about the external ones like PTSD? And then there are internal ones, but yeah, largely anxiety, depression, PTSD are external. This is wrong. The answer is B. So while it looks like a catchy headline, but yeah, let's just say I am a little more creative. Okay, let's do the last question for the day. I know, Tanvi, I'm trying to behave like the examiners. Come on now, hurry up. Okay. Any other answers? A, C, A. All right. Okay, let's understand these words first. What is the difference between a neuroscientist versus a psychiatrist versus a psychotherapist versus a psychologist? Now, a neuroscientist is the one who is working on your nervous system. So let's say if I have, God forbid, there is a brain damage in any situation, okay, an accident related to the brain or the spine, who are you going to? You're going to a neuroscientist or a neurosurgeon. A psychiatrist is one who can give you clinical help in case of mental disorders. It could be anything from shocks to medicines to drugs to CBT, anything. Okay. Psychotherapist is somebody who does only therapy, CBT, cognitive behavioral therapy, counseling and therapy. Counseling and therapy are different, but yeah, largely therapy. Psychologist is anybody who's a scholar or a student of psychology. You get a degree in psychology from any college, you are a psychologist. Alright? In the very first line of the passage, this is what the author says. I come at this dilemma as a neuroscientist. It is a direct question. Yeah? The author is not talking from the other's perspective, she is talking from her own perspective. It is a neuroscientist's book on mental disorders. It's not from a psychiatrist point of view और a psychotherapist point of view और a psychologist point of view. वो neuroscientist है, इसीलिए वो brain को लेकर बात करती है, feelings को लेकर कम बात करती है. सही याद आया तनिष्क, it's an easy question. तो आप इन अच्छे दिखने वाले ऑप्शंस में ना फंसें, ठीक है? हाँ, बुलाती है पर जाने का नहीं. All right. This is the article source. Okay, so you read this article if you want to again, although we've completed it. And of course, the homework remains the same, that you have to take more mocks and keep analyzing them. If you don't know how to analyze them, watch the analysis session from my profile. I'll see you on Wednesday. What is your answer? Come on, article or PYQ? क्या करना है Wednesday को? जल्दी बताओ. You want me to do a previous year question paper or like a question or a passage? Or you want me to do a new article? In the meanwhile, check out campus placement and IT jobs discussion that is happening for TCS, Infosys, Cognizant and other exams. Okay, so you can avail this facility. Article PYQ. Okay, so let's do PYQ for a change. Article के भी वोट आ रहे हैं भाई. Wednesday को PYQ कर लेते हैं. Friday को focus concentration पर कुछ practical बातें करेंगे. If you have questions, get them. We'll discuss it. Let's make it a student oriented session on Friday. I'll also give you my inputs. And then next week we'll do an article. थोड़ा boredom कम हो जाएगा. Any subject, Tanishq, you can send your suggestions. Okay. So that's all from my end. I hope you had a great time. I'm looking forward to a fantastic decision making class at 7:30. Till then, take good care of yourselves. Do press